Well, I think we've seen a number of changes. Certainly access has been improved. We now have 15 million more people covered across the country. We are beginning to see the shift on how we get paid, going from fee-for-service to actually measuring outcomes, and you get paid if you do well. The third thing is that we're seeing improved access, and more people are moving to being outpatient patients and instead of inpatient, and so you're seeing more and more opportunities with huge growth in outpatient visits across the country, going up 5 or 6% each year. So major changes, and in order to accomplish this, we have to make care more affordable. And so we have worked very hard at reducing our costs. We've taken about $500 million out of our cost of running the Cleveland Clinic over the last couple of years.
How do you do that without affecting care?
Well, actually, one of the great ways we've done it is we've put together what we call Carepass. And Carepass do a couple of things. They standardize how you're going to look after somebody, and that reduces the variation and also reduces the cost as you do that. So you get better quality at lower cost. And so we're seeing that in multiple different procedures. We've got about 100 Carepass organized across our institution. So it's really a very significant change in how we look after people and how we make care much more affordable.
Toby, I know the Cleveland Clinic is a unique place. There aren't too many hospitals that are doing things that are quite as innovative as what the Cleveland Clinic has always been known for doing. And I just wonder, when you say that doctors are now getting paid for outcome versus getting paid for just showing up and per visit, I know none of the bills that I've paid have changed. How widespread is this across the country?
It's changing slowly across the country, but clearly the emphasis is going to be more and more in that direction. We now have multiple different quality metrics that we report to the government, and that determines our pay, and increasingly the pay is judged on the basis of the quality that you do. We report about 115 quality metrics to the federal government each year, and they are rising gradually.
Is that a good thing or a bad thing? I mean, speaking from a hospital administrator who's there, these are a lot of things that you have to report on. My guess is it makes you improve on some of them, but is it too much?
Well, I don't think it can be too much. I think what we want to do is get the outcomes that we report appropriate. And in the past, a lot of them have been processed. In other words, did you give the aspirin when somebody went to the emergency room? And now they're becoming increasingly about actual outcomes and measuring outcomes. And as you know, measuring outcomes is a very difficult thing to do because it varies on the sort of patient that you're looking after. So we're getting increasingly sophisticated on how we do that, and the risk factors are taken in. Some patients are easy to take care of, some are very difficult to take care of. But this is an evolution, and healthcare is evolving very rapidly across the United States. We're seeing tremendous innovations going on all the way across the healthcare system. It's a huge change.
Hey YouTube fans, I'm Landon Dowdy from CNBC. Thank you so much for checking out our channel. You can subscribe by clicking right here to check out the latest Mad Money CEO interviews, market news, financial advice, and product unboxing. Enjoy!